Certainly within a 2-week period. Obviously, the goal with redesigning this office is that they will be more adept at answering and become more proficient and have more validity in terms of the answers to those questions. And we felt obviously that's very key because the answers to those questions are critical for supporting not just decision making within DMA and DHHS, but also providing information to oversight groups such as yourself, as well as to other groups in terms of CMS and external regulators.
Just to follow up on that, but the number you gave is we should expect the turnaround on that question to be 2 weeks, or a similar question for that type of request?
It's obviously, each request is unique, but typically a window of appropriate timeline would be around a 2-week time frame.
And then one final area I want to get you. One of the things we're seeing as kind of a key feature of the new contract seems to be recruitment and recruitment support. And as I kind of see this contract, it's your job to kind of work your way out of this contract and let the department take that over. What is the success we've seen right now? I know I saw some individual positions listed, but for supporting the department's recruiting efforts and helping them bring additional individuals into the department, how much of that have we seen at this point, maybe in total numbers?
We have that in total numbers and have to review, but we do help Mark Ogle's team track on a weekly basis recruiting activities, where offers are, outstanding activities. Obviously, we work closely with the HR group within DHHS and DMA to do that, and I know that several individuals, especially in senior positions, have been filled. Since we have really started on the recruitment path, know that there are multiple jobs posted at this point, jobs such as the Director of Compliance, Finance Director, other positions that are key that we've been supporting in terms of writing those jobs descriptions and having those overseen and reviewed by DHHS for final posting. I believe at this point there have been several positions filled, and have to confer with Mark to get the specific numbers at this point, since we've started our efforts.
Mr. Gogol, do you have that number?
Yes, I can say since June 1, we've filled about 25 positions in DMA, and recently in the last, within the last month, 2 in the Business Information Group.
Senator Robinson?
Thank you, Mr. Chair. Just a couple of things, and I heard earlier what Mark was saying in terms of some of the barriers he was encountering, et cetera, but I need to get back to the beginning, because we've talked about contracts before and what the deliverables are, what the outputs are. So, Madam Secretary, this really may be your question. First, I'd like to understand what is the amount of the contract, and is the payment based on specific deliverables? What is the period of time? I heard Dr. Lynn says she plans to work out of this, and that's a good idea. But is there a period of time for the contract, and is the payment based on specific deliverables, or how is this handled?
Madam Secretary?
Senator, we have an entire presentation, the next presentation on this. Mr. Chairman, would you like us to go on with the next part of the presentation about contract?
We'll come back to that. Let's take a few more questions.
One other thing, Mr. Chair, follow up, and I appreciate getting that at that time. That's fine. I want to get back to the recruitment piece, because is your intent, Ms. Dr. Glenn, in terms of what we heard about the recruitment, still the barriers Mark is talking about, which some sounds to me like really vetting candidates properly or meshing the process together from human resources to DHHS, some of those kinds of things, is part of your work to help with those kinds of processes to make it an easier process or a more effective process to get candidates through when we come to recruitment?
Yes, Senator. So part of our work is, as we look at realigning all of DMA, is to have more rationalization and clearer responsibilities for individuals. So it is certainly easier outside of salary pressures and compensation concerns. It's certainly easier when you can sit with somebody that you're recruiting, especially at a senior level job, and be very clear as to the expectations for that job, how they will report, what is the performance measures, what's going to be the team underneath them, and to have clarity and focus when you can sit with them and recruit them. So part of our responsibility is to help HR and help the leadership make sure that that comes across very clearly and with intent to potential recruits, and that the job descriptions are, when I say rationalized, I mean looking at how that compares with other roles and responsibilities within DMA, and certainly if there's clarity over where one responsibility ends and where another one is, and talking about a healthy collaborative environment where people can work together, where you can rely on information to make decisions, and where you have the right kinds of support, whether it is from business information or from fiscal, especially if you're in a programmatic role working with individuals.
Representative Avila?
Thank you, Mr. Chairman. This question is directed towards Dr. Glenn. We've heard here how what you're doing is going to improve reporting so that we have a good idea when we get numbers that the right amount of money gets to the right places. And we know that we'll have the best people in the offices of DHHS. My question is, how is this going to be reflected within the responsibility of DHHS in the lives of the people of North Carolina? With this improvement at this level, what is the trickle down, what is the ripple effect, whatever you want to call it, going to be in what we have to do with the clients, the recipients of our services in the state?
Let me answer your question from my own experience working with some of the other state programs that we've had similar kinds of approaches in place. Because I've, for example, working with another state, reviewing the outcomes associated with some of our contracts, being able to look at data relative to delivery of services, we've been able to isolate where services are not necessarily being delivered with fraud or intent, but not having the outcomes that they should have, where individuals who are very vulnerable in situations like developmental disabilities are being provided services, but we cannot trace an outcome measure associated with it. And that's because we can look and identify patterns of data, service data, and that ties between services, fiscal payments, and being able to put those kind of data elements together. It tells a pretty revealing story and starts to have transparency over the delivery of services and programs that were historically not available to us. And because of that transparency, that's when contract monitors and the folks responsible for the programs in DMA can start seeing patterns and can start making much quicker decisions about the way services are delivered, about providers and their ability to deliver services, about the intent of those services, as well as one of the greatest outcomes is be able to best match with federal funds and to be able to have greater funding into the system. So I think it is very critical because we have so much opportunity to have data, it becomes not particularly useful until you can have the reporting there that turns that data from information into knowledge and can drive decision making.
Quick follow-up.
Follow-up?
Would this be included in part of your summary report in terms of what we've received as a benefit with pretty clear explanations of how it's going to be impacted in terms of the transparency, in terms of the outcomes that you're talking about?
Yes, and as mentioned, most of our work isn't about writing reports overall, but we do report as to what we're doing and our accomplishments, as well as challenges that we face. And what we do when we highlight, for example, in situations where we work like with the Commonwealth of Pennsylvania, being able to drill into details, making a decision that saved $50 million to the state and not not harm the delivery of services, we do like to highlight where there's been an impact from the decisions and the implementation actions taken. So yes, it will be covered.
Representative Lambeth?
Thank you, Mr. Chairman. Dr. Glenn, if you think about this group as a board of directors, one of the things I've seen that's very effective is a key performance metrics or a report card on how the company or the agency is doing that would compare actual results to some type of standard so that the board, in this case the Oversight Committee, could see how are we improving on turnover, are we doing as well as the industry standards. Are there any plans to have any type of report card available for the agency so that we can look at very quickly to see areas we're improving on, we're beating the standards, or not?
Thank you for the question. Yes, one of the outcomes with our work, especially in the finance and operations area, is to create a financial dashboard to be used within the department for understanding, position and key positions of where things are moving and performance indicators. What was asked earlier by Senator Heiss was around reporting and the timeframes for reporting, not just around improving the reporting patterns and the timelines for delivering reports. The goal is to have information available at disposal so it can be used on a regular basis, and it isn't a separate and unique act to keep reporting all the time. So there will be a financial dashboard created as part of our effort, and that will highlight key performance indicators that will support management decisions.
Senator Page?
Thank you, Mr. Chair. Dr. Glenn, this has been a very refreshing briefing thus far. And in the exchange with Senator Heiss, you mentioned, I think 14 days as the time frame for getting a report on eligibility for Medicaid. Would you define that as being a difficulty, and perhaps maybe the counties should be taken out of that equation in some manner so that we can have more accurate information? And tied in with that question, I take it that your company has been invited to come in to take a look at procedures like that and other things that have been going on within the department for a long time, and advancing what you would say would be improvements and efficiencies that we can model our department after based on what you're finding?
Secretary Walsh, did you have another statement you wanted to address that?
Doctor, if it's possible, and Senator, if perhaps Steve Tedder would be kind enough, because the question is very specific, and I think it will benefit the committee to have more clarity when we say things about how long a report is. What does it mean on the ground? And perhaps if it's possible for Steve Tedder, who's the lead business information unit, he leads the business information unit in DMA, he can describe what that really means.
Mr. Chair, members of the committee, thank you. My name is Steve Tedder, and I have a way of experience. I have 29 years in IT, most of it in senior management or executive positions, 8 years in state government, and the remainder in the private sector, primarily in financial services and insurance. With respect to enrollment, going back to Senator Heiss, your question, as we get the infrastructure in place and we get the analytics group built, questions like that will be regularly, the garden variety questions will be published and they will be made available, so you don't have to make a data request for them. They will be available on the dashboard or through other means. That's a key thing. I don't know if I'm answering your question or not, but the question of enrollment has been, that's a very simple sounding question. And part of it, and most of the time, it's a simple answer. what we have made, the reason it has taken more time than you would anticipate is that we wanted to make sure that the numbers went out right, that they were consistent, because right now we are pulling enrollment information from the EIS system and the NC Tracks, not NC Tracks, but NC Fast system, and that's in a state of transition. The other thing that we need to do is make sure that we understand exactly what we mean by enrollment, because part of that in terms is the answer to that question is partly in terms of the context of the question. If you want to know how many people were enrolled for the purposes of this month, that is one number. If a year from now you want to know how many people were enrolled in September, that will be a different number. And so there's part of what our role in data analytics is to get much more precise in terms of the information we provide, and to a certain extent make sure that we understand the nature of the information request so that we satisfy it completely and accurately and consistently. Does that